This is a patient education video to hopefully help with catheter care at home. So if you've had a urological procedure, it's very normal to go home with a Foley catheter, and that can be a TURP, PVP, aquablation, or even a robotic prostatectomy. When we go home with a Foley catheter, it's important to do a couple things. Number one is drink as much water as you possibly safely can. That oftentimes dilutes the urine. That way, if you get a little bit of bleeding, we don't end up with a clot and issues with the catheter not draining. The second is really take it easy with the catheter, especially if you're only going to have it for a couple days. And what I mean by that is, in general, we don't want you mowing the yard or out doing those types of activities where potentially the catheter can get dislodged, or you might have more catheter type pain. When you go home with the Foley catheter, so this was just a small through-way Foley catheter. There is a balloon on the inside, and so this is what holds the catheter in the bladder. And this would sit, for instance, if you had a prostatectomy, this would sit above where the anastomosis, or for an aquablation, this would sit above the prostatic fossa. And so the catheter sits in here, and so issues that you could have would be potentially pulling on the catheter. You can imagine if you pulled on the catheter, that balloon will then pull on the prostatic fossa or the anastomosis. And it is very normal that when maybe you're more active, that can cause bleeding when you were doing really well earlier in the day and those issues. So when you have the catheter in place, it is good habit to take where the catheter comes out of the penis. There's a mucosal layer there that can get dry, and the penis will stick to the catheter. That can be very painful. And so if you pull the penis back slightly and then apply either triple antibiotic ointment, basotracin ointment, gentamicin ointment, and keep the catheter greased up, that can make it a lot more comfortable and decrease the chance that you may end up with a little bit of scarring at the tip of the penis there. And so generally 3 to 4 times a day, I want you to grease up the catheter, and it'll make the catheter more comfortable. Other issues with the catheter are adequately draining the catheter. You always want the bag to be lower than the bladder itself. And so if our bladder's here, the times that we would get in trouble potentially, sometimes when we go home with a leg bag, that bag usually sits on the front part of your thigh. And so people will sit in a chair, and then you prop your feet up, and then you wake up after your nap and there's urine everywhere. What can happen if the bladder doesn't drain adequately is you'll have spasms and leak urine around the catheter, which is not uncommon. So generally what I like to have you do specifically for the aquablation procedure, we're only going to have the catheter for 24 to 36 hours, is to just utilize the night bag, as we call it. And so the night bag is going to have a little bit more capacity, and it's just going to be one tube. So you'll have this hooked up to your Foley catheter, and you'll go home with one of these 3-way catheters. Generally, when we send you home, this port, the small one to the side, will have a small blue plug. This is the balloon port, and this central port is where the urine drainage occurs. And so oftentimes you'll have the catheter bag hooked up to this port. And what I like you to do, or what seems to be the easiest, is to have the catheter secured to the leg, either with a stat lock or a catheter strap. This is an example of a catheter strap, and then the stat lock. The way the stat lock works is it utilizes adhesive, and then you utilize it to clip the catheter in. The most important thing with the catheter, and it just clips like that. The most important thing with a catheter is having slack on the catheter itself. So always make sure that the catheter is not on any tension, and that you don't put yourself in a situation where you might snag the catheter on something, or a dog might potentially play tug of war with it. I've seen that happen a couple times. And so try to keep it protected as best as possible. I think the easiest way to manage a catheter, from personal experience with my family, would be to cut a hole in like a pair of sweats. Just get like an old pair of sweats, run the drainage bag tubing through the hole in the front, and then hook it up to the catheter inside of your pants, and then you'll have the catheter bag coming out. And then when you're up walking around, you can simply, there's hooks on the bag, you can simply hook the bag like this, and then when you sit down in a chair, you just drop the bag on the ground, and then it drains adequately. This seems to be, at least in my experience, is the easiest way to manage the catheter bag. Other options for catheter drainage would be a leg bag. The leg bag is meant to be completely hidden under clothing, and that's why it's designed the way it's designed. To me, it's a little more complex for a couple reasons. The main one is there's potentially 2 points where it hooks into the catheter, and then also where it hooks into the bag here, where potentially if you're walking, this can come dislodged, and so keep an eye on that. The catheter bag is fixed to the leg with these straps, and you just strap it around the leg, and then you just hook it in using these eyelets. Most people will put a leg bag on, and you can put a pair of sweatpants over the top, and then that way the entirety of the catheter bag would be covered. And so a lot of times we'll manage with the big bag or leg bag at night. And again, you'll want the bag lower than your bladder. So specifically when you're lying in bed, you'll want it close to the ground or the floor. And during the day, most of the time, again, the night bag, just from a simplistic standpoint, it's got larger capacity and it doesn't have as many connections, less likelihood that it's going to become dislodged. But if you are going out in public and you want to cover the catheter, then that's where switching to the leg bag is a good option. Other questions with a catheter that are fairly common are, how do I shower with a catheter? There's a couple different ways. The main way I tell people is just unhook the catheter bag and put it on a hook next to the shower, and then just shower with the catheter draining into the tub. The issue I found where patients have had the catheter and the bag hooked up in the shower, I've had a couple patients that have had trauma to the catheter just because they got tangled up in all the tubing. And so that seems to me at least to be the most straightforward way, but you can do whatever way you're more comfortable with from that standpoint. So the main, was it still on?
No.
Okay, so the main takeaways are drink a lot of water. That's going to help decrease the chance the catheter is going to become plugged. Make sure that you apply either triple antibiotic ointment or base tracing ointment to the tip of the catheter multiple times throughout the day. That's going to make it more comfortable. And then just knowing when to use the different types of bags. Again, the leg bag is going to be when you're out in public, and the night bag is going to be at night. But then most of the time when you're at the house, and making sure that the catheter bag is lower than the bladder. Some other common issues that occur with a catheter, specifically for patients that have had a prostatectomy, we have to have a catheter in for 7 days. It's very normal for you to have urgency, frequency, and a little bit of feeling like I have to go to the bathroom. You have a bladder spasm and urine goes around the catheter as well as through the catheter. That's fairly common, especially when we've had that catheter in place for approaching that 7-day mark. As long as there's urine that's going into the catheter bag, then the catheter is not plugged and it's functioning. But that can be very frustrating sometimes. But again, what's happening is you're having a bladder spasm, and then the urine is going through the catheter, but also around the catheter. Other issues that people have at home with a catheter are, heck, there was something else I was going to say. Can you guys see anything else? There's bladder spasms. Oh.
Okay, so say other issues, just start over your sentence. Other issues
Okay.
people have at home.
Other issues that folks may have, it's very normal when you have a bowel movement that a couple things happen. So the rectum sits right behind the prostate. And so whether you had a prostate surgery, aquablation, or a prostate removal, it's very normal to leak a little bit of urine around the catheter when you have the bowel movement. You'll oftentimes have a bladder spasm at the same time. It's also normal to have bleeding after the bowel movement, and that just has to do with the close proximity. And so that's very normal as well, and usually is transient.